Welcome back to the show, everybody. On today's episode, we have a very, very special guest, Justin Fiesel. Justin, how you doing, sir?
I'm good. How are you?
Good, thank you. Yeah, motivated to learn more about you and how you help people. So with that being said, can you please tell us a little bit about yourself and what you do, please?
Well, I'm duly licensed as a clinical social worker as well as a licensed acupuncturist. I've been a licensed therapist now since 2007. Been a licensed acupuncturist since 2023. And I like to think that I combine both mental health and Chinese medicine together to create an integrative to create an integrative practice.
Wow, that is awesome. Justin, so what motivated you to go from being a therapist to kind of focusing on the acupuncture? That's interesting.
Well, being in the field, I've been in the field since 2001. And probably around 2016, 2017, I was really starting to get burnt out. And then late 2017, an old coworker of mine from Florida, because that's where I'm from originally, she put something on Facebook that she went to this conference and it changed her life. And her and I are trained in the exact same thing. I'm trained in EMDR. I'm a hypnotist. I'm trained in a form of brain spotting. And so I messaged her and I said, look, what kind of snake oil are you peddling? And she messaged me and said, this will change your life. You got to do this. And it was called the neuro-emotional technique. And so early 2018, I went down to Florida. I booked a conference, went down to Florida, and I was in a room full of chiropractors, acupuncturists, nurses, therapists, and a smattering of doctors. And the instructor came out, excuse me, the instructor came out, asked for volunteers. He touched their wrist, touched their forehead, and all of a sudden these people felt better. I'm like, this is snake oil. And so I was thinking to myself, I'm only going to be here for a couple hours, and then I'm going to hightail myself to the beach and have a 4-day vacation away from my kids and drink margaritas. That was my plan, right? But then all of a sudden, it happened to me. And I felt as if I saw Jesus walking on water. It's like everything inside my head became clear, my thoughts were gone, and things really started to change. So, and the person behind it, the person who started this technique, I thought was a mad scientist, right? So I didn't know anything about the science behind it. I just learned the technique. So I came back to North Carolina, started doing it with my patients. And what really started to scare me was, or in a good way, was I'd work with grief and shoulder pain would disappear. I'd work with anger and knee pain would disappear. And I'm like, what is this? And I'm probably one of the biggest nerds you'll ever meet. So I dug and I researched, I learned as much as I could. And I realized all this dude did was package concepts of Chinese medicine and put into a nice little package so he could sell to the masses and make a ton of money. Well, now I learned what it was. I had to know the whole system of medicine. So there was a school near Boone. And for the 4 years, I drove up and down the mountain while maintaining my private practice, trying to learn this medicine. And I learned as much as they were able to teach me, passed my boards, and now I'm practicing. And it's been a life-altering, life-changing, for the better, best decision I've ever made.
Wow. So many threads to pull on there, Justin. I like to go back to what you said earlier about it happened to you. How did it happen? Because it sounds like after the first day you were like, "Hey, man, this is kind of snake oil stuff. I'm gonna leave." So how did it happen to you? Like, were you called on stage, or like
I wasn't called on stage? So I mean, they all had volunteers, and then we were practicing on each other, and they started touching on old past. I don't want to say traumas, but events in my life at that point were problematic for me. And I didn't think of them as problematic now, or back then they weren't problematic as I was learning this technique. But when I was able to go back in my head, I could see where my brain was stuck. And then it unstuck me. And it blew my mind how well it worked, right? And something big happened to me at the end of 2018. My mom died. And I pulled the plug on her. And when I pulled the plug on her, she was begging, screaming, crying, didn't want to die. And she told me 2 months prior, when I get to this stage in life, I need you to end the treatment and let me pass. And when I pulled the plug, She was literally crying and screaming, didn't want to go. She was in and out of reality, didn't know what was kind of going on. And it took her 4 days to pass. And about a week, I want to say about a week after she died, right? I was on the edge of my bed at night, just rocking, just like this, going, my brain was just spinning because every time I closed my eyes, I killed my mom. Ooh. And my wife is a psych ER nurse. And she looked at me and she goes, I don't know how to help you. And when I had a group practice at the time, again, before I got into acupuncture, I taught one of my coworkers how to do this. And she came in one morning and I said, look, I need this out of my head. I need this out of my head now. 10 minutes later, it was gone. I don't have the guilt. I don't have the shame. What I did for my mom was a true act of mercy and an act of love. Don't get me wrong. I miss her. I love her. I believe I'll see her again one day, but that everything was gone. And she died. When did she die? September 16th. Yeah, so September 16th she died. And I have missed her death date at least 3 times. Like, it's just gone. And I'm like, oh yeah, mom died this day. Or her birthday is July 4th. So that's a big celebration. And every July 4th, I mean, I don't even think about it. It's like, all right, I'll open a can of beer and say, happy birthday, mama, and I'll light up the grill. It's not even, there is nothing there anymore. Again, I miss her, but it's gone. That told me how well this worked.
Wow. And Justin, so what did that partner do that really kind of helped in the moment? Like when you were doing okay, well, let me back up. So it sounds like, did they help you in the moment, like during the seminar or the workshop or whatever? Like, did you feel something then?
The seminar helped me see where some of my deep-seated stuck points were, particularly let's say with sugar, my parents' divorce when I was a teen, a couple past relationships, nothing that I would think I would consider to be traumatic, but apparently at that time it created a stuck point in the body.
Wow. Okay, got it. And so then flash forward, you'd finish the
forward
seminar.
To later in the year, my mom died. I pulled the plug, and I need the NET to get me through it.
Got it. And do you mind sharing some of what she did, or I'm sorry, your coworker did, to kind of help you?
Literally, all she did was she touched my wrist, she touched points on my back, and I touched my forehead. And I was thinking about those emotions when she was touching my wrist. My wrist will tell me what type of emotions are prevalent or needed to come out my subconscious. And as she brought that out, I would go, oh yeah, that makes sense. And then all of a sudden I would close my eyes, touch those points, and I could feel it leave the body. And I needed her to guide me through that so I could come to the level of peace. And it literally happened within 10 minutes.
Wow, that's so interesting.
A week after she passed.
Is that an acupuncture technique, Justin, or is that something different?
It's not it's based on acupuncture, but it's not an acupuncture technique. I mean, I learned it before I became an acupuncturist. I was just a therapist.
Got it. Okay. Wow. So you're a therapist at the time. You own a group practice. You tell your coworker, "Hey, I need your help. Do this, do that." They do it. And then what changed for you as a therapist and even a group practice owner in the moment? Were you like, "All right, I need to close it and go in this direction," or did it change anything for you?
It did. I always felt I was missing something as a therapist. I knew I wanted to do more, but my license wouldn't allow me. And it's try not to go too woo-woo, but I can almost feel where a patient is stuck in their life, but I didn't necessarily know how to address it. And acupuncture allowed me to get to that point where I can address both the mind and body to get to where a person needs to be in their healing.
Yeah. So do you still have your group practice, Justin, or did you kind of shift?
No. I got rid of the group practice the second I got licensed for acupuncture. What I did was I told my therapists that worked with me that I'm going to transition to acupuncture. They had like a four-year time to figure this out. And as they got closer, we had more conversations of what they're going to do. I helped them get their own private practice started, helped them get through the paperwork. My goal was not to leave them stuck or leave them suffering. And all of them have successful private practices now. So, and I refer to them constantly.
Wow, that's great. Yeah, and you know what? Kudos to you, sir, for helping them out, because I wouldn't have been surprised if it was just like, hey, we're closing up shop, figure it out. You got some
You
time.
know what? I've had that done to me, and I don't want to do that to anybody. I know what that feels like.
Yeah, I love that. Justin, okay, so wow, big shift, change direction with the group. You let it go, helped out your coworkers, and then what came next? Did you actually start like your acupuncture office and start seeing clients?
I took a week off and I repainted, redecorated. It went from a counseling practice to an acupuncture clinic within that week. I still run the mental health website because I think my passion is still mental health, but at the same time, I do not do counseling. All I do is either acupuncture, neuro-emotional technique, or supplement testing. So yeah, it looks way different, but it feels very similar.
Yeah. I like to shift gears for a little bit and talk about the acupuncture itself. It seems like acupuncture has there's a lot of misinformation, maybe, if that's an appropriate word to use, or some myths, maybe some misunderstandings about acupuncture itself. And I've heard other clinicians be like, oh, acupuncture, even doctors that are like, that's just foo-foo, and whatever. But interestingly, like, I'm hearing like real passion, real enthusiasm in something that you experience yourself.
What I have seen, I cannot unsee. And I will say this. If I was an atheist before I started the program, I would be a believer in something when I came out, because this changed everything. I don't know how to explain it. And that's where it gets difficult for me, because for me to learn the medicine or the acupuncture, I had to completely immerse myself in that thinking. And it's hard for me to go back to a more of a Western mindset of thinking of how to relay it to, I guess, a layperson, because it's so powerful. I can talk about it forever. So whatever you'd like to know, I would tell you anything.
Yeah.
We can talk about it all day long because it's just fun.
Yeah, I appreciate that. Well, first of all, I'd like to ask, what are maybe one or two things that you've seen that just kind of blew you away about acupuncture?
The biggest one that blows my mind, you know what? I don't think it's the biggest anymore, but it's definitely weird, is I was in the acupuncture clinic as an intern, my final year of training, and a woman came in she was bitten by a copperhead on her heel. And she should have gone to the ER, but she's doctor phobic, didn't want to go to the doctor, and wanted us to treat her. And when I took one look at her, I tried to touch like the bottom part of her knee where the injury was, where she was bitten, and she screamed in pain. And I don't know what to do with this. And so I talked to my supervisor, and I look, what do we do? He goes, watch this. And what he did blew my mind. He took a diabetic lancet, so where you would pick the skin to create some blood, and he found a sore point on each shoulder, and he pricked it so a little bit of blood would come out, and then he took cups, like when you do like fire cupping for sore muscles or whatever, and put them on the back of the shoulder where the bleeding was. We left it there for about 20 minutes. The blood came out, it coagulated. It was absolutely disgusting. So we cleaned her up, took that off, and she was able to walk. And I don't know how that works. And it blew my mind. I know how it works now, but then it was, nah. That was true wizardry in my book.
Wow.
In terms of mental health, I've had patients come in. I've had a few people who at one point were actively psychotic, or at least were on the verge of going actively psychotic. And literally, I can put in a couple needles, usually in their toe, maybe a couple in their head, and instantly the voices slow down or completely stop, and head becomes clear. It is so quick, so fast, and it makes absolutely no sense to somebody without any Chinese medicine training of why this works.
Wow.
It
That's so
just
interesting.
it feels almost magical.
Yeah. And so when you talk about these stories, Justin, I mean, I heard the little lancet. When I think of acupuncture, I think of like those little needles, like the really thin needles.
They are so thin,
Yeah.
thinner than human hair.
Are those always used in you know what I mean, to do some of these things, or are there like different tools and instruments available?
There are different tools.
Okay.
The vast majority of the time, it's going to be needles. So in my training, the ultimate goal of acupuncture is not to have to use any needles. So what I mean by that is, in school they taught us Tai Chi, and what Tai Chi is, it's a form of movement meditation to get to know the body, our bodies, and how the energy starts to flow. And the ultimate goal is, once a person gets cultivated enough through their Tai Chi, yoga, whatever a person does to self-cultivate, the ability to use needles, the need for needles goes down. So the ultimate goal is just to be able to touch the person, control their energy in the body, and let the person heal. That is, I've seen it happen a few times. I've had it done with me, with a patient, a few times, and that's cool.
Yeah.
And that feels even more woo. So that's why I'll always use needles, even if it's not needed, because most of the time people expect it.
Got it. Wow, that is so interesting, Justin. What has been well, first of all, I want to go back to that story of the client that could, that could walk. What was her reaction?
Oh, she was shocked.
Yeah. Wow.
She was shocked. Now, she needed subsequent treatments for it to stick. So what I mean by that is, right, when we put the needles in, we tell the body the energy of the body, and that's a whole different topic in itself. We take the energy of the body and we feel where it is imbalanced, and then we put the needles in specific places to create the balance that we need. And once the body's balanced, the body can heal. And once the person's balanced and they're healing, function usually returns, in a younger person, usually returns to normal. In an older person, it takes more time, because we got to build them up, because as we get older, our energy decreases. So it takes more sessions. And and usually when the first time I balance somebody, right, they're good for 2-3 days, and then they start to revert, because the body, that's all the body knows is its old way of functioning. So each time I give them the acupuncture, I'm gently telling the body, remember how you were designed, remember how you were made, remember how to function, and then slowly bringing the body back. Younger people require less treatments. Older people, unfortunately, require more.
Wow. Yeah. Dang, that is just kind of mind blowing. Okay, so if I hear you correctly, the goal of acupuncture, very simplistically, is to get balance.
Correct.
And once there's balance present, then the healing can start. Does that sound about right?
Absolutely.
Got it. Okay, got it. And also, that healing, the length of time that it takes the healing to actually do the healing, it varies by individual based on age and I suspect also like the gravity of the injury or whatever's going on.
Correct.
Got it. Okay. Off camera, you mentioned to me about the copperhead bite. You had a client or saw somebody that got bitten by a copperhead.
Yes, and that's what I said a few moments ago.
Oh, got it. Yeah. Wow, that is so interesting. So what? I know you mentioned diving into Eastern medicine.
Correct.
Like, how much other studying were you able to do, and like what have you incorporated into your practice?
Ask me that another way. I mean, I'll tell you, but that's kind of broad.
Yeah.
Ask that question in a different way. Angle it for me differently for me.
Sure. Yeah, I could do that. Are there other things that you've studied that maybe one or two things that you've studied that you've also incorporated? I know you mentioned acupuncture and then you did that seminar. Are there any other maybe modalities or techniques that you've learned that you're like, oh, I'm going to rope this into my practice?
I mean, prior to acupuncture, I was a clinical hypnotist, and I practiced EMDR almost exclusively.
Mm,
But since that, all I do now is strictly acupuncture.
got it.
I believe in other modalities work.
Hmm.
I come from the belief that I'd rather be a student of one, and then instead of a jack of all trades and a master of none. Um, so I figure the more I deep dive into Chinese medicine, the better I'm going to get, the better outcomes I'm going to have with my patients, and the more fulfilling I will feel in the practice.
Yeah. Justin, I like to go back in time a little bit. You mentioned experiencing burnout. What was that
You
about?
know, long hours, fighting insurance companies, fighting getting co-pays with some people, and I was done. I was seeing, I think my record in 1 week as a therapist was like 50 some people in 1 week. I
What?
was burnt. I only did that a couple times in my career.
Yeah.
Usually it was somewhere between 35 and 40 something a week, I would see. Plus maintain a group practice on top of that. That wasn't sustainable for years. I was just done. And I'm the breadwinner in the family. So my family relies on me. So I had no choice but to do it.
Yeah.
Um, yeah,
Yeah.
I was
Wow.
done. I got tired of it. Started to, you know what it did? It started to feel like a revolving door,
hmm.
and different faces, same problem. And I didn't like it. I was done.
Yeah.
20 some years, I'm done.
Yeah. Wow. Well, you
And,
know what they say, when one door closes, another opens, and it sounds
mhm.
like, yeah, this one was just a phenomenal door that opened for you, that just kind of led you to a new one, a new world, of healing, and learning. Justin, I like to ask about the client's journey.
Okay.
How do you ensure that you're a good fit for the client and that a client is a good fit for you?
What I tell people is when they meet me for the first time, I tell them to plan on 3 to 4 sessions. And if I can't get them to where they need to be, or at least on the track to where they need to be, I am the wrong person for them. Not that acupuncture is wrong, but I am wrong. And that seems to put people in ease. And I can tell pretty quick whether or not what I plan to do is going to work. Um, it's and I don't know really know how to explain that. I think that just comes from putting my hands on thousands of people over the years and treating so many people. But I have a good handle on immediately if I'm going to be able to help this person or not. And I'll tell them. I'll say, look, I'll give you my best. I'll give you everything I have, but I don't know if I can get this or not.
Yeah. Yeah. Wow.
So
So let's say somebody comes in and, well, actually, let me back up a little bit. Do you do like a free consultation maybe? How does
I
that?
don't. I mean, I will talk to people on the phone for free.
Yeah.
So if they're interested, I'll answer any questions. Or if
Mhm.
they come by my office and we'll sit and talk, and I'll answer anything they may have. But generally speaking, when I'm in the clinic, I'm back to back with patients.
Got it. Got it. That makes sense. Okay, so let's say a client comes in, and they seem to be a good fit. You're a good fit for them. They're a good fit for you. What does the first session look like?
First session looks like I let them pick the room if both rooms are available. I have them sit on my acupuncture table and I just talk. I'm like, what brings you here? I like to go into everything blind, because if I go into a session completely blind and don't read anything beforehand, I get to know the patient for who they are. And what I like about Chinese medicine, I don't have to know much of anything. All I need to know is what hurts. Oh, my shoulder hurts, or I have anxiety. Perfect. That's all I need to know. And then when I explain to a patient, that only thing I need to know is what does your pulse feel like? I take 3 fingers and feel the radial pulse, and how their pulse feels in my fingertips tells me everything I need to know about them. And if the pulse messes me up, or if I can't quite figure it out from the pulse, I'll look at their tongue. So the pulse tells me what's going on for the first right then, right now. The tongue tells me what's going on for the last 6 months to a year. And that's what I explain to them. And then I feel the pulse, have them lay down, and it's really, really quick. From intake to needles is maybe 10 minutes.
Wow. Yeah.
I'll answer any questions. I'll sit with them. I'm not ever really in a hurry.
Mm-hmm.
But in terms of intake, first session, it's that quick.
It's quick. Yeah. And wow, that's got to just be a testament to, one, your knowledge, your experience, and yeah, I mean, just your confidence in what you're doing, right? Like, yeah, that's great. So what does progress look like, Justin? Let's say somebody partners with, they show up, they do the thing, they lay down, they show you everything. What does progress look like?
Progress to me is, I'll say it this way. I get mad when I don't get the miracle, because I expect significant progress usually within the first session. So what I tell people is, particularly with pain, if I can get your pain down in one session, I can get you the rest of the way. How long it takes, it might be another story. But once I get it down, I know I can get it. It's just a matter of when. And that usually is pretty significant for people, because once they know, okay, I do feel a little bit better, I know I can get it the rest of the way. And so that keeps them coming back.
Yeah.
If the ones that I don't get down right away, that starts to make me question, what am I doing wrong, or what is the patient doing on the day-to-day life that's causing this repeat injury to continue? And that's harder. That's a harder conversation to have with people.
Yeah.
So.
Yeah, for sure. Justin, are there things that you suggest that your clients do outside of the office to kind of sustain that progress?
Yes. What I tell people is, right afterwards, don't take a shower till the next morning. If they drink, don't drink till the next day. Let the body try to integrate with what we just did with the needles. I do give dietary therapy or dietary advice. But I mean, what people do outside of my office is obviously their choice. I also do supplementation, and I test where the body is weak. And if they're willing, I will give them a supplement. But again, everything's their choice.
Yeah, that's interesting. The client that makes the most progress, are they kind of doing all of those things? They're doing a little supplement, they're following your suggestions, maybe doing a little changes to the diet, and then doing the work. Is that kind of max load, so to speak?
That is.
Yeah. Nice. All right. So, Justin, let's say somebody partners with you and then they start doing the sessions, the treatment. When do you know when it's kind of time for them to either graduate or terminate their course of acupuncture?
So if it's for mental health, right? I tell people, you will know when you are done. And when a person knows they are done, deep down in their being, they know it's whatever that was bothering them is gone. They can't find it. They can't touch it. There's nothing that feels like there's any residual stuck emotion somewhere. Even it's a unique feeling. So I'll have patients come in. I might see them for a period, let's say a couple weeks at a time, and they come in for that last session thinking they have a lot of things they want to come out. We'll do the NET or the neuro-emotional technique or the acupuncture. And once they come out of the session, they'll look at me and go, I'm done. And that is probably one of the coolest experiences. In terms of pain, in terms of physical ailments, when the pain stays gone longer than the session, that's when we start to decrease. So for example, let's say I'm working on a shoulder, or I'm working on somebody's sciatica pain, right? If I'm seeing them every week and they are pain free from that week to the following week, can we go 2 weeks? Or can we go 3 weeks? And if we can we go a month? And once we get to that point, I look at a patient and go, why don't you just call me when you need me? And usually that's the case.
Yeah, that's awesome. And it's really cool to know that you are aware of their progress and then tapering them off. Justin, what if like there's somebody that's like, no, I want to keep coming. Like, can they continue to make sessions with you, or is there a point where you're
Absolutely.
like, okay,
Absolutely. Acupuncture is cumulative. I give myself acupuncture probably once or twice a week. I give my wife and my kids acupuncture regularly, just to maintain overall health and immune function. So yeah, it's beneficial.
yeah, that's so cool. Justin, what has been the feedback from clients that you've seen in the past about the work that they've done with you?
In 2 years, 3 years, whatever it's been, 2.5 years, I had like 54, 55 5-star reviews on Google. So I mean, it's pretty big. It's pretty cool for only 2 years of being out. Or I got out in 2023, so I guess almost 3 years now. So it's yeah. I get a lot of word of mouth referrals these days, which kind of surprises me for only being out a couple years. So it tells me I'm doing something right.
Yeah, for sure. And I can only imagine the that growth as time goes on, of more and more referrals being made your way. Yeah, pretty soon you may have to hire a couple of employees. I don't know if you have a staff, Justin. Do you actually have a staff? Some providers that
I have an AI receptionist. Her name is Lily.
Gotcha. Yeah. I mean, yeah, that's a good way to start too, right?
Yeah,
Answering some of those phone calls and stuff. Wow, Justin, yeah, that's incredible, man. And I again, going back to what I said earlier, I think it's just a testament to your experience and your confidence. And I mean, people wouldn't be giving their friends and family members and loved ones like referrals to you if they didn't truly believe in it, and
absolutely.
it must be some remarkable service that you're giving folks out there. So kudos to you, sir.
Appreciate
Um,
it.
I like to ask about the future for your practice. Any like maybe courses that you have coming up, or any like online coaching programs, anything like that, Justin?
I have a very small school community that I've slightly neglected over the last couple of weeks, that I'm trying to teach. So I have adapted the neuro-emotional technique to something what I've called the pulse code, because over the years I've stumbled on the ability to feel somebody's emotions through their pulse alone, instead of using forms of muscle testing. And I find it to be way more accurate than testing somebody's muscle to see if there's an emotion that is stuck somewhere. And I have it all laid out on my free school community, because I just want to get the word out because of how well it works. But life happens, and I've completely neglected it.
Oh, all good. Yeah. And that idea of like knowing about an individual just based on their pulse is just fascinating to me,
I give it away for free, so because I
Yeah.
want people to know it, because I don't want it to die with me. I want it to be expanded, but
Yeah.
it's hard to get that ball rolling.
Yeah. Is there any training out there if somebody maybe wants to do like an in-person, like seminar, maybe they learn better that way, that you would recommend?
I recommend anybody and everybody to get the neuro-emotional technique training.
Mm,
Every therapist, I think, should get it. And I think it destroys EMDR. I think it's way better than EFT, or the emotional freedom technique. I think, man, I've seen more miracles with NET than I ever have with EMDR. And I've had thousands of EMDR sessions over the years, and nothing has come close to what NET is able to do.
Wow.
So
Yeah. I
NET
mean,
to me is every therapist should learn it who is interested in trauma.
yeah, for sure. Like all things, Justin, there's probably some good courses, some bad courses. Is there a particular NET class or
There is only
instructor?
one company that does it, and that's still the people who do it. It's called netmindbody.com or netmindbody.com.
Okay, got it. Wow. Why do you think there's so few instructors? It sounds like there's only one out there.
There's not. I mean, it's just,
Oh,
I
okay.
guess, just the one company that started it, and they're just the only ones to do the trainings.
Okay. Got
And
it.
so, and I think a lot of it is it's really woo woo. It
Mm,
doesn't, on the surface, it makes absolutely no sense.
mm-hmm.
It was featured on an episode of Grey's Anatomy about 6, 7 years ago.
Oh, wow.
And when that happened, I got a bunch of referrals from it. So
Yeah, maybe we should plug that episode here, right? Greg's
I would like
Anatomy.
to, but I don't remember the name of the episode.
Oh, wow.
It
Yeah,
was
that's
years
interesting.
ago,
Yeah.
and I don't watch the show. So
Yeah. So there's one company that does it so far, but they have multiple instructors. Is that correct?
multiple instructors. They have
Okay.
trainings throughout the country,
Yeah.
actually throughout the world, several times a year.
Yeah, that's so interesting. Dang, yeah, that's so cool. Justin, if somebody wants to partner with you,
Okay.
they like the way you present yourself, everything that you're saying, and they want to reach out. Well, let me back up actually. If somebody wants, like they're listening to this and they're interested, but maybe they've never worked with an acupuncturist before, maybe it's new to them. Heck, maybe they haven't even worked with a therapist before, and they're reluctant to reach out just because it's like, it's woo woo. Maybe some of the stuff that they've heard out in the mainstream about acupuncture is kind of holding them back. What would you want them to hear?
I want them to know that it's safe, it's simple, does not hurt, and it's very effective. And I mean, if it's over 5,000, yeah, we've had studies going back 5,000 years. We've had people, I believe the Iceman from 5,000 years ago had acupuncture point tattoos correlated to his health condition. So we know it goes back at least that far. We have written documentation of what works going back 2,500 years. And if it was bogus, it wouldn't have survived.
Yeah, for sure.
It's here.
Yeah. Wow. Yeah. Great words of encouragement for those out there. And yeah, I encourage everybody to reach out. I mean, it sounds like some of this work is really beneficial and impactful for a lot of things. Justin, if somebody wants to partner with you, how can they reach out?
Through my website. It's for my mental health website. It's brighthopeimh.com, which is brighthopeintegrativementalhealth.com, or brighthopeimh.com, excuse me. And then my acupuncture site is thepointacupunctureclinic.com.
Got it. And what was that school community called again?
Pulse code, PULSE code.
Got it. Right on. Justin, this has been an incredible, really eye-opening episode for me. I mean, just learning about the pulse and the work that you do. And I'm definitely going to check out the NET, just see what's going on there. And maybe I'll get certified. I don't know how that works.
I hope you do.
Yeah.
Because it was a game changer for me.
Yeah. It just sounds so interesting. And maybe we could do this again in the future, Justin. How does that sound?
I would love it.
Heck yeah. All right, everybody. Thanks for tuning in. Until the next one. Signing out. Bye.